I'm David Willis. I'm a senior fellow at the Center for the Study of Social Policy. I have with me some good friends, and this is our first of what we hope to be a monthly conversation with various people, exciting initiatives and interest areas that are advancing this early relational health, framing early relational health work. At CSSP, we're delighted that we, with the support of the Perigee Fund and others, to be advancing early relational health across early childhood systems work and early childhood communities, knowing that relationships matter to the future building of the well-being of the next generation. So I'm excited today to be joined with my friends from the Reach and Read Network, Nikki Sherman, Usha Ramachandran, and Claudia Aristi. And maybe I first would invite my friends to introduce themselves and say a little bit about their work and especially how that connects to early relational health. So Nikki, might I start with you, please?
Yes. Hello, everyone. I'm Nikki Sherman. I'm the Chief of Strategic Initiatives, working at the National Center for Reach Out and Read. And my job is chiefly to think of initiatives that improve our impact. What is it that we can do to really improve the way that we serve the families out in the world there? And that has been primarily a focus more recently on how do we best promote early relational health through Reach Out and Read. It's an exciting job for me. Everything that we do in Reach Out and Read, it's important that we learn from our pediatric care providers. They're the ones who do the work. They're the ones who are going to tell us if this is practical, if they can incorporate the changes that we're making, and let us know how it's going. So I spend a lot of time liaising with our pediatric care providers in the field. That includes family physicians, pediatricians, nurse practitioners. We love to hear from them all and to work with all of them. And then more recently, we've been putting a much stronger focus on learning from the families that we serve as well. And so I have the privilege of working with families, with pediatric care providers to improve the impact of our program.
That's phenomenal. Nikki and I are good friends. We talk at all hours of the days and times and weekends and the like in terms of this good work, but it's joyful to be partnered with the Reach and Read Network, and specifically Nikki with you. And you mentioned families, and so maybe Claudia Aristi, can I turn to you as to what your connections are to the early relational health and Reach and Read? Whoops, a little sideways. Are you still there, or shall I go to Usha? I think I'll go to Usha. Okay, Usha, let me come to you as a dear pediatric colleague. What makes you do this work?
Absolutely, David. I'm totally honored to be considered a Willis friend. Very happy to be here today. I'm an academic general pediatrician from New Jersey. I've been providing Reach Out and Read in the office for over 17 years now. And for the last several years have been the medical director for Reach Out and Read New Jersey. I've been working with, the Reach Out and Read national leadership on incorporating early relational health into the Reach Out and Read framework. I also, as a faculty member at Robert Wood Johnson Medical School, I teach students and residents, and I'm currently leading a project in New Jersey to increase the education and early relational health for all pediatric residents across New Jersey as well. I also work with the New Jersey chapter of the American Academy of Pediatrics as the early childhood champion. And one of my priorities in that role as well is to promote early relational health. And I'm really happy to be working with all of you.
Well, we're thrilled, Usha, for your leadership and the inspiration you're giving to other pediatricians in Jersey, and of course to residents, getting them early, right? So they learn about the criticalness of this transformation that we're really hoping to lead, about the careful attention to earliest relationships and their promotion of strengths. So, and Claudia, let me turn to you. How you doing? You okay?
Yes. Thank you, David. And I apologize for the technical difficulties.
That's good.
My name is Claudia, and I'm the director for the Reach Out and Read program at Bellevue Hospital in New York City. But my first job actually is as a mom. So I'm here representing both sides. I'm a parent of a 24-year-old boy who got his first book from Reach Out and Read now at the pediatric clinic here at Bellevue. So I have experienced this program firsthand, and I can testify to the difference it makes, because that book really helped me be able to establish a closer connection with my baby, and have another way of relating to him throughout the day. So it's exciting. And now, 21 years into this, I have had the honor and pleasure of working with the program in a professional capacity, leading the program at Bellevue, working very closely with the residents and the attending doctors and with the family. So I work very closely with the families in making this concept of the importance of early relational health one that they can grasp, understand, and see that they're already doing a lot of wonderful things. I'm not here to tell them how to do it or what to do, because they're already doing a lot of beautiful things with their children, and they just need support and encouragement. And I'm excited to be here, so thank you for inviting me.
Yeah, thanks, Claudia. That's really good. And the parent perspective in all this work is so essential. I learned when I first came to CSSP about the importance of really paying very careful attention to the family experience. As we think about advancing early relational health, we want to be solely strength-based and recognizing the capacities that all families have and why their relationships with their babies and their families matter so deeply to them, and how we as health providers can partner to strengthen those capacities from the very start. All of this work about early relational health is not about judgment or finding problems. It's really about strengthening the assets and the capacities all families have, and providing extra support when it's valuable, and the dialogues that we can have with families about relationships really matter. And I'm excited today because we're talking about Reach Out and Read. And why that really matters to me is because the importance of the health system and pediatricians and family practitioners and their relationships with families really matters. And we learned a long time ago that in pediatric care, we care deeply about our relationships with families from the very start. And we care deeply about their experiences to the benefit of their children. And me as a pediatrician knows that the foundational relationships really matter. In fact, early relationships now we know shape the health, the well-being of both the child and the caregiver. That relationship's dyadic and is meaningful to all. And we know when we talk about early relational health, we describe that as the positive and nurturing relationships that advance physical health, development, social well-being for the future. It is for many a new term, but actually it's not a new field. We're taking what has been learned over the last decades out of neurodevelopment, of child development, out of infant mental health, out of psychology, out of all of the good work in child development, and saying it matters deeply that we focus all of our work in child health care additionally to strengthen those relationships for future well-being. And that's the excitement I have, is that Reach Out and Read likewise came themselves to realize that foundational relationships really matter. And I was fortunate to be able to partner with them a few years ago around their next chapter interest. And that's where we began finding the spots in which our work around advancing early relational health and the opportunity of partnering with Reach Out and Read came to be a sweet spot. I would add one more comment, and that is our good friend Colleen Kraft, who just passed president of the AAP, some years ago said to me that, you know, relationships are the new vital sign in pediatrics. And so we've been on the journey of finding what are those vital signs in early relational health that we can bring forward into pediatrics, ever more thinking about how Reach Out and Read can help us along that journey of discovery. So Nikki, can I turn to you to talk a bit about your experience and how you're thinking about this early relational health next chapter work and how we found a sweet spot of working together?
Yes, absolutely. It's been a wonderful journey. Reach Out and Read actually has always been about relationships, right from the beginning. And over the years, there's been a lot of talk about how important it is to engage over the book, and that's been incorporated more and more into Reach Out and Read. And so we just knew intuitively that that was important. But then along comes the research that demonstrates unequivocally that it is important. And so then the whole field started to really blossom of let's focus on the importance of relationships and how that sets the stage for health and well-being throughout life. So as we were doing that, Reach Out and Read realized that as this field blossomed, we wanted to be a part of that. We already had a model that really promoted early relational health through pediatric care as the foundational layer. And we wanted to work with others and be a part of this field that was developing this work. And we also had many conversations about what is the end point that we're looking for. And we came to the conclusion that we want this promotion of early relational health to be a standard part of pediatric care, that it's in the core, that it's an expectation that every pediatric care provider is promoting early relational health. And we began to think about what are the things that are needed to make that happen. And so 2 years ago, was it? Yeah, we had the Next Chapter Forum. We called this work that we're doing the Next Chapter, working on early relational health through Reach Out and Read. And we had a forum where we were celebrating actually our 30th birthday, but we thought this was a great point to invite everyone that we knew within pediatric care and actually surrounding pediatric care to come and join with us and talk about it and actually help Reach Out and think about what is it that we need to do specifically to help advance this cause. And the message came back to us that there are certain things that Reach Out and Read can do. We have the benefit of a big network of pediatric care providers, and we can work with pediatric care providers to socialize this idea of early relational health, to make sure that everybody knows about it, understands the importance of it, has training and skill building to be able to implement the promotion of early relational health, and actually to start building momentum from within the field to transform the field, to create the change and drive the change. And so that has been the focus of what we've been doing. How do we provide the skill building? How do we make this, how do we socialize this through our network in the hope that this will grow? We also wanted to look a little bit more at our model and see if there were ways that we could innovate to really promote early relational health in a very meaningful way. And we have Usha here, who's going to talk to us a little bit more about that, so I won't steal her thunder. But for me at the moment, that's the most exciting work going forward. It is looking at emotional connection and the thinking behind that and thinking about how we might incorporate that into Reach Out and Read.
Yeah, Nikki, it's been an amazing journey to look at the front edge of innovation about how do we begin to train the eyes of pediatricians to be able to understand the foundation of early relational health development. And that brought us to the work of Martha Welch at Columbia and the Nurturing Science Center that has been working for decades on observational processes that now is called the WECS, which is the Welch Emotional Connection Scale. Within that good work has been the recognition that there are some fundamentally observable characteristics that define autonomic emotional connection. And so we started asking the question is from what's been observed from the WECS work and Martha's work at Columbia, could some of the findings be brought into the training of the eyes of physicians to be able to see and understand some of these emotional connections? So with the generous help of the Einhorn Collaborative, we began a pilot process of exploring how can one bring what's been learned from the rigor of science into practical application and practices. And Usha, that's where you and I met. And I wonder if you would like to talk a bit about that experience and about how what you experienced with some of the training about autonomic emotional connection, and more importantly, how does that how do you think about that impacting your practices, or also now what you're doing in Jersey? Your thoughts?
Absolutely. So I came into all of this. Actually, I want to step back a little bit in terms of what Nikki said. As we, did reach out and read in our office with families, the one thing that became very clear to most of us is that the magic really was happening in those parent-child interactions rather than just in the literacy promotion aspect of it alone. And so we always kind of intuitively recognize the importance of that. But the evidence that came in terms of the importance of early relational health kind of, supported that. And then for me, when I joined this project with you and Nikki and Claudia and everyone in terms of trying to take the WECS from a research setting and trying to put it into a reach out and read clinical setting, a completely new avenue of thought sort of opened up for me, and new tools got added to my toolbox, so to speak. And it's, so I've worked in a learning collaborative with other pediatric care providers, other pediatricians, family medicine docs, a nurse practitioner, and others, and parents as part of a collaborative learning process. And Martha Welch sort of trained us in how to do the WECS, the WECS observation. And we all kind of took it back to our offices and tried it with our patients during well-child visits and try to see how that would work in real life in a busy 20-minute, well-child care setting. And then we came back and we talked about what worked, what didn't work, learned from each other, learned from Martha, learned from the Reach Out and Read leadership, and then kept on doing that process over and over again over the past several months. And so it's just been like an amazing journey for me. As much as I was always sold on the concept of early relational health, the importance of it, and everything, I had never been trained. I had never been shown a way to sort of actually, even observe a parent-child dyad in a clinical setting. I was trained, of course, to examine the child, to screen the child for developmental delays and so on, behavior issues, developmental delays. But I had never been trained before to actually look at the parent-child dyad and to focus that attention intentionally on that connection in that dyad. So this work sort of really opened my eyes to that. And when you said, David, about Colleen Kraft saying relationships are a vital sign, now I feel like I have a tool to kind of include that as part of my assessment. Or as part of the observations that we do. One of the things that we decided as a group early on when we started to do this and adapt the WECS to a real life setting is that we sort of decided to make it more of an observation than an assessment with a score attached to it and so on. It was just a means for us to, have some objective ways to observe the parent-child dyad. And then we didn't just stop there with learning how to observe and, the dyad, but we were also, we came up with ways to, support the dyad if in fact, there were some, the emotional connection needed to be strengthened. So Martha Welch was able to share with us these cards that, with lots of tips for parents on things that have worked in her nurture science program, things like telling parents to talk to their kids face to face every day about emotional topics, things like, why they named the kid their specific name, the story of their birth, stories of their grandparents, and things like that, emotional topics, which from their work and other work has been shown to really promote that emotional connection. So we're able to now send parents home if we feel they need that extra support with that advice, with that, we discuss this, we give them a card, we send them home. And, we're able to then, see them back sooner if we need to, if we have really, if we're really concerned, or just see them back at the next visit and see how they're doing and so on. So I think it's just really just added a whole new dimension and a really important dimension to the work that, we already do as pediatricians during the Welch Child visit. And I have to admit that I was a little worried that it might be hard to do it during a Welch Child visit, but the more I've done it over the past few months, it's just become much more natural. Sometimes it's really quick. I come in and the parent and child are already interacting right there, and I see all those aspects, the 4 domains, the attraction, the vocal communication, the facial expressiveness, the reciprocity, it's all there. So, but then in the past, that would have just brought a smile to my face and I would have gone on with my well visit. But now I take the time to say, oh my gosh, this is amazing. Look at that connection between you and your baby. This is so important for the baby. It's the foundation for everything to come. And then, so I'm able to start a conversation around it, and provide positive reinforcement. And if, there's things that need to be worked on, of course, like I said, we can talk about that as well. So I just feel a lot more empowered in a sense, in terms of what I've gotten out of this whole journey. And it's been a journey and I'm still learning. I have questions at every session. And I'm still learning, and and that's the thing. It's just the whole process, I think, has been great in terms of, being able to learn with even the parents being part of learning collaborative, hearing their voice and, exchanging ideas. So
And
it's just a great process.
That's phenomenal, Usha. First of all, your description of learning some of the vital signs of early relational health and how that becomes now a part of the way you are with families, training and tightening up your observational skills. And you also alluded to the importance of how do we talk with families and share our experience with them, and how do we actually strengthen the relationships of every family that we're with. And that brings me to Claudia. I'm curious as you've begun this journey with us too, and thinking about relational health and thinking about the parent experience, what do you think is meaningful for families as we are moving along this journey? Your thoughts?
Absolutely. But I think I want to be able to step back a little bit as I was hearing Usha describe all of this amazing work and this journey that she has been going through. I think when we talk about relationships, it's not only that parent diet and child diet that we are talking about. We have to think also about the relationship between even the parent and the provider, right? Even the relationship between us as colleagues on how we're supporting each other in this process, in this journey. So when the parents are really good about telling when someone is being authentic and caring and being present in the moment or not. And even if you don't have all the tools that Usha is describing, when you're being there in the moment with that family and trying to really connect with them, and they are able to then, it's amazing. I have seen it firsthand when a family is able to connect with the provider at a deeper level because they can sense that that provider cares about them, and they can that the provider is taking the time to see and make those observations that Usha was describing, right? Or if also that the provider is taking the time to listen to what they feel is important to them. Because we could be here giving a recipe for what we think is important, but what do you think is important? And I think just turning that ear to the families and saying, we're partners in this. It's not only me trying to provide help and advice for your child, but that we can be partners in this process of us as providers learning a lot from the parents as well. And I can tell you that in my 21 years, I have learned more from the parents than probably what I have been able to share and with them. So I get so much more, but it needs to, you need to have a disposition to be able to be open for that learning, enjoying learning, and seeing the parents as equal partners in the process, because they have a lot to bring. And I think that makes an amazing difference in the way we relate with them and the way they relate back to us. So that then when the next time when they come back for their visit, they're more open to discussing, hey, listen, I've been doing this the last time we spoke and you gave me these ideas. I've been able to do it at home with my children, with my family, with my spouse, with whoever is part of that family. That it really translates not only to what is happening in the waiting room or in the exam room when the family is here, but it has the reach that it has is you can never imagine how far, because then that family is also taken and not only to the immediate family unit, but to their community, because they're starting to then role model something completely different than maybe what they had been exposed growing up. And in thinking about innovations too, I was thinking about how some of the innovations we have done here at Bellevue in extending this type of connection with families to begin even before the baby's born. So we have now a program called My Reading Promise, in which we talk to the pregnant moms about the importance of starting to connect with their babies before the baby's even out of the uterus. In the different ways in which they can do that and how that helps with the emotional connection, that baby is able to hear the parent's voice, will be able to recognize it, will be able to feel the connection, will be able to feel loved and cared for even before that baby is out in the world. And that the parents are very receptive because that's something that for the majority of the families that we work here at Bellevue, maybe it wasn't part of the culture, maybe it wasn't part of their upbringing. But they have seen that every parent want to do the very best for their children. And when they see that the benefits are not only for the child, but for yourself as an individual too, because of the love and the connection that you're able to create through these special teachable moments in which nothing else exists but that second when you have your child, or whoever is there in the room with you, and you're stopping to make that connection, I think is so powerful.
Claudia, you raised something really interesting that I'll touch on, a comment that's come into us in the chat. But relational health actually begins, is also visible and important in the prenatal period. How are the connections that pregnant mothers and families have with others matters, and how their own experiences being connected with others, those relationships, can especially be valuable when there's moments of stress or challenge or trauma. As Marlo Nash, who's the co-chair of the National Traumatic Campaign, just asked us, he's commented that they're working hard with community leaders across the country to ensure that systems are well embedded with the awarenesses and the knowledge of trauma and resiliency sciences and practices and approaches. Relational health really matters in terms of resiliency building in face of trauma and recovery. Relationships are part of the recovery process, most of all, too, in terms of the importance of the conversations. And I'm aware of some of the innovative work in early relational health that's been going on in DC, where there's actually been the first level of the relationship building with families in the primary care sector is about first having relational health conversations. Let's have a conversation about your own experiences and your families, which always awakens often the stories of a family of origin, or the stories of traumatic experience present, the opportunity that we can have to partner with families to say it can be different for your next generation. And let's keep the conversation going in terms of how we can assure the future well-being of your child, no matter from where you've come. It's a new day and a new opportunity, and I'm glad we're having these conversations. We think there's a unique opportunity to advance relational health, also to counter the trauma and the vulnerabilities by history that we can talk about directly together in terms of them promoting the strengthening of important relationships over time. And as we learn ever more, the vital signs of strong relationships, bringing that training, teaching, opportunity for guidance with all families becomes a part of this larger agenda. So Marlo, thanks for that question. I want to ask each of you, what excites you most about this work? And maybe, Claudia, can I come to you first? What excites you as you hear this movement and effort around advancing early relational health, emotional connection within Reach Out and Read and then primary care peds? What excites you about it?
What excites me is that it really puts the emphasis on what is the most important thing, relationship. If we remove relationship out of the equation of what we're doing, this I don't know what this will be, you know? So that excites me. It also excites me to be able to learn from the families how we can support their role, and how we can support each other. How that's going to translate into how we start doing things slightly differently, in taking care of the families and being able to support them. Because I think they are the experts in many ways. They might see us as the experts, but when we acknowledge and empower them to see themselves as the experts that they already are, I think that opens up a different set of doors. And then the conversations that we're seeking in this work, right, to be able to have with them really will start flowing more freely because the families are already feeling validated in their role and in the experience that they bring to the work that we're all doing.
Claudia, in my own experience clinically many years ago, as you're saying, what was most thrilling to me was how families so value our attention to their own experiences and their families' relationship growth. And I also, what excites me about the work too, is bringing such deep respect to a family's abilities to grow and heal and themselves, and how we as healthcare providers and then people in early childhood systems want to be a part of that journey with families to their own goals and efforts. That thrills me. And now as we're in an anti-racist period, and as we're trying to counter all the barriers that have been historically interfering with well-being, that we're now trying to work ever more intently, relationships are the driver of building future well-being. The stronger the relationships are, even in face of some adversities, if we're intentional, have tremendous power. That I think, again, trying to make that very visible, that thrills me. Nikki, how about for you? What excites you about this good work?
I think it's the fact that we've kind of turned the corner a little bit from adverse childhood experiences, which felt that it was a lot of bad news, through to positive childhood experiences and to relationships, which is the good news. And so we're in a good news phase. We have something very positive to say to families about this is what needs to happen. And as we've been talking about, working out with families and learning from families, that we can all work together in a positive movement towards a better world, really. It excites me when our pediatric care providers who are doing Reach Out and Read come back to us and tell us about some of the conversations they're having with families, talking about how this is transforming the exam room experience. That being able to use a book about being able to talk about relationships also transforms that relationship, as we've been saying. And to me, this is a sea change, really, isn't it? It's like transforming the whole place. I guess I can't wait to see where it's going to go.
It's absolutely exciting. We've similarly heard those stories from practitioners and families that are saying this is really valuable, especially that sense of emotional connection and how to create opportunities for the experience of that for families themselves, but also for we as physicians witnessing the impact of that kind of messaging. How about for you, Usha? What excites you about this work?
So as I look back at all the work that I've done over the past 6 months, one of the things that I've noticed, which is sort of a side effect, and Claudia kind of alluded to that, of this early relational health work, is in supporting families in building those connections with their children. I feel like the prompts that we use, the conversations that we have are, talking about why the parents chose their baby's name. it just brings forth so many stories that give me a window into that family's life, their culture, their priorities, their hopes, aspirations. And it's really the side effect of those conversations has been that my connection with the family has been strengthened. So I feel like that's what sort of really, I mean, all of these things that all of you have mentioned excite me, but this is an additional thing that excites me as well. Just the fact that these early relational health conversations are helping support those physician family connections as well. And that's, in this age of physician burnout, that's something that is really important. That's something that's going to sustain us. And, yeah.
It so reminds me how much of it is a privilege that we have as pediatricians to be with families in these very special ways. And when families choose to share with us the story of how they just chose the name for their dear child, it's so touching to hear and so intimate when shared that it's just a privilege to hear that, but it's in service of, so valuing the meaning that this all has for families. I want to bring a question though, because I've often heard cautions to us around early relational health, that sense of, for some families, the sense that we as physicians could be too judgmental, that we may be not very interested, or that we as physicians may not always be trusted, that we're really valuing the strengths that all families have, no matter what their place in life is or what their culture or their race is, that there are barriers and vulnerabilities that trying to advance a way in which we're partnering with families, shall we say, both observing and bringing recommendations and guidance, could be heard in less than positive ways, or worse, some sense that we're too much judgmental and not honoring the strengths of families. What are your thoughts about that? And how do we be careful? And what are you hearing? And how do we be cautious about partnering in meaningful and valuable ways for families? What are your thoughts?
I would say that it's something that we have already been talking about, which Usha mentioned earlier. And I think one is about being mindful and being observant. And when you take the time to make the observations to families about the strength that they already have, that then brings down some of those barriers or some of those preconceptions that the families might have, because when they see that you're noticing, when they see that you're hearing what they're saying, what they're doing. So for example, if I have been walking in the waiting room, right? And I know there's a beautiful interaction between a parent and the baby. And part of me wants to step back and just look because it's so beautiful. But part of me wants to go also and acknowledge that father for what he's doing and telling him, you're doing a great job. This is amazing. This is beautiful. And actually, it's a privilege for me to be able to observe that. So thank you for sharing that moment out in public, which is fantastic. And when that happened, that father actually said to me, no, thank you, because I'm actually keep doubting myself if I'm doing a good job as a parent. And when I hear the validation from someone else saying that what I'm doing is the right thing, that helps me feel that I'm in the right path, because as a new parent, I have a lot of doubts and a lot of questions. So when you take the time in to be able just to observe and say something to the families about what you're already observing, what are those strengths that you observe in their interactions? And maybe it's not even in the interaction with the baby, maybe it's in the interaction with you. And saying, for example, I have noticed that every time you come very well prepared and you have questions for me. And that I really appreciate that, because that tells me that you value our time together, that you value getting the information you need to take care of your baby. And that in itself, can mean a big difference to the family, that we are noticing and encouraging them in the sort of connection that they're having, not only with their babies, but also with us. So it's really doing what we are asking them to do. It's not only preaching, it's actually doing it. ourselves and being cognizant of how we're connecting or not with the families. Because if I say that I care about your questions, but I ask you if you have questions for me and I'm holding already the doorknob, that means I'm out of here. I'm not present in the room anymore. I'm not with you. I'm running to the next patient. So it's really being mindful of how we're acting in the things that we're saying to the families that might reinforce some of the negative ideas that they might have of us as providers, but at the same time also pointing out to all of the wonderful strength and all of the wonderful things that they're already doing.
Thank you. And Usha, if I can come to you with a similar question, but push it a little further. There will be, of course, in pediatrics, there are moments where you're with families where the emotional health or the emotional connection is not as strong as one would wish, or you observe a situation that you're a little uneasy about. How do you approach that in really sensitive ways? How do you try to find a way to partner with families to their strengths, yet try to find paths to help them strengthen what you could, what makes you uneasy about what you're observing relationally? How do you approach that?
So I think the number one thing is sort of having the mindset that emotional connection is a state, not a trait. So what I'm seeing at this moment in time is not like an, destiny, or that this is what always happens at home. So really sort of, coming at it from that point of view in terms of this is a state, not a trait. This is not a judgment that we're making of families of any sort, but just saying that, some of the things that, always recognizing the good things that that parent is doing. Every parent that I've ever interacted with, I can say with confidence is, doing something right, and is trying, is concerned, and to really look for that and acknowledge that, I think is really important. We know how hard parenting can be. And none of us were born, none of us went through like parenting training before we were parents. So it's a learning process. And so to just sort of, really find the things that they're doing right, and to just, and say, these are some of the things that have worked for other families, that, there's people have studied families, and these are some of the things that have worked for other families. And say, does this sound like something that, might work for you? To sort of phrase it in that manner. And then I think the telling families to have those face-to-face talks about emotionally important topics really tends to resonate with families as well. And it just sort of, I think it just makes sense. It resonates. And I think that's, I haven't had it hasn't been a hard sell, in other words, and so those are some of the things that have worked for me. And like I said earlier, I'm still learning. I'm still on that journey. And the bottom line is we have to listen to our families. We have to really listen. We have to get feedback. And Nikki could talk a little bit more to this, but this is why at every step of the way during this initiative, we have incorporated the parent voice. Parents are part of our learning collaborative. We hear from them every single meeting. And then here in New Jersey, the Burke Foundation has generously funded us to be really able to study all of this, especially with the focus on the parent voice. So we've done focus groups in New Jersey asking parents about, what do you think the role of a pediatrician is in, helping families establish these strong connections? And a lot of really interesting things are coming out of those focus groups. Those are still in progress. And once we've come up with the training, we will pilot the training in 2 sites in New Jersey. And a big part of that pilot studying that the intervention will be asking families, so did your pediatrician talk to you about, these topics? What went right? what do you think, how did it feel? How could it have been better? So really hearing from them. So doing in-depth, interviews, focus groups with parents to really understand how it feels like on the other side of this interaction, and incorporating that into what we do.
That's true.
But I'll let Nikki.
Really phenomenal. We've got just a couple more minutes, and I want to finish up with a final question before we close, and that is, so where do you think we'll be in 5 years? Nikki, can I come to you? Where will we be in 5 years? What's your vision of this? What do you expect?
Yeah, my vision, my true vision is a 10-year vision, a 10-year vision where the promotion of early relational health and emotional connection is part of the guidance for all pediatric care providers. Through the Bright Futures guidelines, which is produced by the American Academy of Pediatrics, we wanted to be a standard part of care. To be able to get there, we need to put all the pieces in place that are going to make the foundation for that to happen. We need to be providing skill building for our physicians. We need to be doing the research that proves that it works. We need to be spreading the word out into the communities. And so my 5-year vision is that we have that foundation there ready to go with the big work that happens for the following 5 years.
Thank you. That's like the champions. We need the champions that are leading. Usha, how about you? Where do you think we'll be in 5 years, 10 years?
So I envision by the end of five years, hopefully having robust research to back up all of this work that we're doing, getting it to a point where we can, we'll be teaching it to medical students and residents, and it becomes, and then in terms of my vision for New Jersey, would be to do just that, to get it incorporated into the, residency programs and training, and then work with the NJAAP in spreading this awareness among the pediatricians in the community, and as through Reach Out and Read, getting more sites to join this work as well. So that's my vision for the next, for 5 years from now.
And you're well on your way with your leadership of this good work. And Claudia, how about you? From a family perspective, where do you hope this all ends up for families in 5 years?
I hope that in one aspect that we are able to find ways to continuously engage with the families, so that we can kind of form parent champions groups in which they can lead each other in the process. It's not only us, but that they can become also, in a way, the next chapter, right? We started talking about the next chapter of Reach Out and Read, and now we are passing the baton to the family, saying, you are also powerful and a powerful agent in changing the community and those who surround you in promoting this amazing work. So empowering families to the point where they want to be engaged, they want to be involved, and they want to take it to the next level. I also envision a time when we don't have to say this coined term of early relational health, and people look at it like, what? What are you talking about, right? Where people know, just the same way in which we're hoping that one day everybody knows what Reach Out and Read is, and they don't question what it is, because it becomes definitely part of this world in a big way. The same thing for early relational health and emotional connection, that when we're having these conversations, we don't have to even spend the time talking about what it is, but we can really dive into it. And continue to find ways to support each other and support the parents.
Phenomenal. Well, I like that idea of the next chapter with families. Excites me in deep, deep ways. I'm thankful for my friends who are on this journey all together. And this is our first of Willis and Friends Around Early Relational Health Conversations. We will be having more into the future. In fact, the next similar process will be July 21st, 2:00 Eastern. And we have our colleagues from New York City, The Power of Two, that's focusing on relational health healing and community building. Another team of amazing people carrying the innovation space forward of this movement of advancing early relational health. So I'm thankful today to Nikki, Usha, Claudia for the time that you spent with us. Thanks to the audience for being with us. And we wish you a good day, a good rest of your week, and then future weekends. Thanks so much. Bye-bye.
Thank you.
Thank you.
Thank you.